All right, well, welcome everyone, and thank you for joining us today. I want to begin by emphasizing that our goal today is to provide valuable information, resources, and guidance for those who are on a cancer journey, assisting a loved one with their cancer journey, or may face it in the future. And this webinar is not intended to diagnose or showcase any specific cancer treatments. But today we are joined by a panel of experts of CUIMC oncologists, representatives from our EAP, the Employee Assistance Program, and UnitedHealthcare's Cancer Support Program. And together we'll be discussing key aspects of the cancer experience, from understanding a diagnosis to navigating treatment options, sharing resources, of course, and creating a supportive environment for both patients and their families. So we hope that the session is going to offer you some insights and support to help you or your loved ones navigate this difficult journey with care that you deserve. So without further ado, since there's many questions ahead of us today, I want to introduce you to our wonderful panelists. So first off, we have Dr. Dawn Hershman. So Dr. Hershman is an American Cancer Society Professor of Medicine and Epidemiology, the Deputy Director of the Herbert Irving Comprehensive Cancer Center, and Interim Chief of the Division of Hematology and Oncology at Columbia University. She completed her medical degree at the Albert Einstein College of Medicine and completed her internal medicine and oncology fellowship training at Columbia University Medical Center, where she actually served as chief resident. And during that time, she completed a master's in biostatistics at the Mailman School of Public Health, and she has developed nationally recognized expertise in breast cancer treatment, prevention, and survivorship. Dr. Hershman has developed a nationally recognized program to improve cancer care delivery, reduce disparities, and enhance the quality of life for breast cancer survivors. And with funding from top organizations like the American Cancer Society, the National Cancer Institute, and the Department of Defense, she has contributed to over 600 scientific articles in her field. And her leadership extends to national roles, including vice chair of the SWOG Cancer Research Network and key positions with ASCO. And Dr. Hershman has received multiple prestigious awards, including the Advanced Clinical Research Award in Breast Cancer from the ASCO and the Giants in Cancer Care Award. She also serves on editorial boards for leading oncology journals and is a dedicated mentor and rising stars in the field. So thank you and welcome. And next up, we have Dr. Melissa Accordino. She is an associate professor of medicine at Columbia University, where she serves as the director of ambulatory operations, quality and patient safety for the Division of Hematology and Oncology, as well as the fellowship program director for hematology and medical oncology. In these roles, she leads initiatives to enhance clinical efficiency, safety, and education within the division. Dr. Accordino's research focuses on improving cancer care delivery and cancer survivorship through patient-centered approaches, really aiming to optimize outcomes and quality of life for individuals undergoing cancer treatment. And our next two are Dr. Mayrene Hernandez from UnitedHealthcare. And Dr. Hernandez has been with United Health Group since 2012, currently serving as part of the National Medical Director Team as the Senior Chief Medical Officer and the Vice President of Healthcare Strategies. Her expertise spans employer group management, network contracting, value-based programs, ACOs and negotiations, case management support, and quality of preventative care initiatives, including collaborations with large groups like Columbia University. And with over 18 years of experience, Dr. Hernandez is a board certified in family practice and osteopathic medicine. She's a practicing physician and a strong entrepreneur. She also holds a degree in health information management and hospital administration from Florida International University and is certified in coding and billing services. Dr. Hernandez is also a clinical assistant adjunct professor at Nova Southeastern University, where she mentors medical students and residents. And in 2016, she received the highest distinguished alumni award awarded from NSU. And of course, from our EAP, we have Alan Levin. Alan has been with Columbia University as their account executive for the EAP for over 15 years. And Alan has over 23 years of experience in the industry and also as a licensed practitioner in, Alan will explain when he gets to that point. I don't want to butcher it. So forgive me with all of that. I do want to actually jump into our questions with, first off, starting with understanding cancer diagnosis and treatment options. So with this one, I'll actually tee it up to Dr. Hershman. Can you give us or briefly explain what cancer is and how it develops in an individual?
Sure. So I think, it's important to understand that cancer isn't one thing. It's actually many different diseases. And as we've gotten broader and broader in terms of our understanding, sometimes people use the word cancer like it's one entity. But basically, when cells divide, they have certain genetic codes that help them know how long to live, and when to die. And what can happen as you age or you're exposed to various different uh, toxins in the environment or radiation or your genetics, those mechanisms can change and cells can continue to grow and can forget how to die. And that as those cells start to grow and proliferate, it's a lot of the mechanisms that keep them in one place change, and they develop properties where they can invade into blood vessels or spread or invade into lymph nodes or move from one place to another. And that's sort of the trajectory for cancer in and of itself in the broadest spectrum. But each organ that we have, whether it's a blood vessel or a tissue, can go down that process where the cells start to change and can develop a cancer. And then within that cancer, based on the kinds of changes of the DNA, there may be different characteristics within each of those classes. So, as a breast cancer specialist, breast cancer is not one disease, it's actually many disease. And how we approach it and how we treat it and how we follow it can be very different from one person to the next based on the individual characteristics of their cancer.
Thank you so much. And what are the typical steps that are involved in actually diagnosing cancer? Like, are there tests and procedures that are commonly used to confirm a diagnosis?
So the gold standard is tissue. You need to be able to see tissue under a microscope to diagnose cancer. How any one individual person's cancer is developed and is detected can really be very variable based on the kind of cancer they have, the kind of symptoms, and whether or not they were diagnosed by undergoing routine screening or whether or not they were diagnosed because they developed a particular problem. And there's no one common symptom from cancer to cancer, but at the end of the day, there can be clues, either an abnormal blood test, an abnormal mammogram, a colonoscopy that finds something like a polyp or a nodule, some type of routine screening test that detects something that's unusual, and there's uncertainty. And then that uncertainty leads to a path of other tests, depending on what's suspected. But often at the end of the day, whether it's a biopsy of a nodule in the breast or the lung or the liver, or just based on blood tests, sometimes it's the actual pathology that's reviewed by the specialist to determine whether or not there's a cancer there. And if there is a cancer, exactly what type it is and what the characteristics of that cancer are, so that all the information will be available so that the patient knows exactly, how to make sure that they know what the best options are. And sometimes that involves surgical staging. Sometimes it involves CAT scans to understand if the cancer's gone anywhere else. Sometimes it might even involve a bone marrow biopsy to know what's going on, depending on the kind of cancer. But all of that information becomes key in knowing the type of cancer, the characteristics of the cancer, and where the cancer may be located.
Thank you. That's so informative. And also, I'm even hearing like an understanding that people really should be following up on their preventative screenings or even like their annual with their physicians to catch if there is something that may be off. So thank you so much for that. And Dr. Accordino, can you respond or give us an overview on how do doctors actually determine the stage and type of cancer? I know that Dr. Hershman, you went a little bit into this.
Sure. So Dr. Hershman touched on a few of these topics in her response, which were really helpful to set the stage. But as Dr. Hershman explained, all cancers are different, and it's really important for us to approach each patient as a unique individual. In terms of figuring out the type of cancer, as Dr. Hershman mentioned, tissue is really the most important entity, and often there might be testing done to find the right type of tissue to do the biopsy on. But in terms of determining what type of cancer, that's really a pathologic diagnosis that our pathologists help us make based on biopsy results, based on the review under the microscope and specific staining. Sometimes additional testing involving certain genetic or molecular characteristics can help when things are unclear. And as Dr. Hershman mentioned, in terms of figuring out staging, cancers, it's a very big word that encompasses a lot of different things. And there's a huge spectrum when we think of cancer, going from stage 0, which we sometimes think of as non-invasive or sometimes precancerous cells, all the way up to stage 4, which is where we think typically of cancer cells that have spread to other parts of the body. So in terms of staging, again, a lot of this is really determined by how the patient is presenting, what type of cancer the patient has, and often doing additional tests like imaging tests, which could be a CAT scan or a bone scan, could be a PET CT. Sometimes it's done in the operating room to get full information based on lymph nodes, based on extent of the tumor. Sometimes this also involves tests like bone marrows and doing additional molecular and specialized testing.
Thank you so much for that. And can you so when developing a treatment plan and then their families, what factors do physicians consider to ensure that it's personalized for each of their patients?
Is this aimed for Dr.
Yes, for Dr. Accordino.
So, I think as we've mentioned in the theme that all cancers are unique, and it does take a team of us. It's very different than other diseases where often there's one doctor who's in charge of taking care of that individual patient. Cancer is very much a team sport, and we have to approach it that way. We work very closely with not only the radiologists and the pathologists who help us make the diagnosis, but our surgical colleagues, radiation colleagues, our colleagues that help manage symptoms such as palliative care, psycho-oncology, nutrition. The list really can go on and on. And we really take into account many of these factors when we're thinking about individual treatment plans. So on a very broad level, when we're thinking about taking care of someone with cancer, it really, again, depends on the type of cancer and the stage that they have. But we approach the cancer both on the local level, which is often things with surgery and radiation, and also at a systemic level, meaning treating the entire body. And usually that's what we do as medical oncologists. And we have a few different ways that we can approach this. There are things like chemotherapy, which is another word that is very broad and can mean lots of things. And often how it's depicted in the media and on TV and in the movies is really very different than how real life is. And I think it's really important to convey that to our patients because it can be very terrifying when that word comes up. And often what patients expect chemotherapy to be is very different than what it's like in real life. We often, have other entities that we treat patients with apart from chemotherapy, such as immunotherapy and targeted therapy and hormonal therapy, and even clinical trials, which can encompass lots of those different categories. I do want to emphasize that we are very lucky in the field of oncology, that we've had a lot of advancement over the last few years, and having lots of these options has really moved the field and improved patient outcomes. So when I started in this, which I like to think was not that long ago, but each year it gets further and further, the list of options was a lot more limited than what we have today. So every day, I think we are moving closer and closer to trying to manage this, in all stages, much more like a chronic disease, but we're not there yet, but we are making tremendous strides. And, as we mentioned, no two cancers are unique. Often the goal is to try and cure in the early stage and to manage in the later stage.
Thank you. And do you have anything that you would recommend to patients or their family members that coming from the medical team side of it, how can they essentially advocate for particular treatment strategies or for themselves, right? Because even me hearing all of this as a layman person, like it could be overwhelming. How would you recommend that they do that?
It's absolutely overwhelming. And, we, at least as medical oncologists, we are very aware of that. We always tell our patients on the first visit that we really expect them to be absorbing maybe 10 to 20% of everything that's coming at them. So it is, as Dr. Hershman mentioned, very iterative. So we try and paint kind of a broad picture and then break it up into smaller details. But I think in terms of advocating for family members, I think strength in numbers is important because your 10% of what you're absorbing might be different than the 10% that the other person in the room is absorbing. I think being able to take notes, being able to ask questions, being able to write down questions that come up, I think are really important. And also, I think good communication and teamwork is really necessary between us on the medical team side of it and with our patients to really understand patients' values, patients' preferences, so we really can come up with an individualized plan that benefits them so they get the best treatments that will help them, but to avoid side effects from treatments that are not within their goals.
I think just to add to that, it's important to understand that it's a story that unfolds over time, and that often, it's all of the, we don't know yet, we need to order these tests, you have to wait for the test to come back, then you meet, then maybe you need more tests, and it's a process to get all of the information before really being able to come up with a plan. So people should have a realistic expectation that it's often going to be many visits. And so usually it's okay to ask the same questions over and over again at each visit because it takes a lot to understand it. And also to know that it's always better to get all of the information so that you can make the best plan as opposed to rushing into something with an incomplete picture.
Thank you. And so I've heard both of you sort of mention side effects when it comes to cancer treatments and when we're talking about the individual patients with their particular type of cancer. So you've mentioned that common side effects of cancers could, they can be fatigue, nausea, pain, even neuropathy or hair loss. Can you give us like a broader overview of the typical kinds of side effects, especially when you're mentioning chemotherapy, and how can patients manage those particular symptoms? Dr. Hershman.
Okay, I think it's important to know that there are hundreds of different types of chemotherapy, and patients get, in addition to chemotherapy, sometimes they get pills that affect their hormones. Sometimes they get shots that affect or infusions that affect their immune system, or other types of newer treatments that may be also given by pills, or maybe complicated, what we call targeted therapies. And each drug has its own set of side effects. So it's hard to say that there's one side effect that is universal. Not all chemotherapy causes hair loss, but if it does, we have ways to help now maybe protect the hair with various different types of devices. Some drugs may cause a higher risk of infection. So that may mean that patients need to be monitored more closely, or they get drugs to help prevent them from getting an infection. Probably throughout the course, the most common side effect for all of these different treatments is fatigue. And that is probably a universal that goes from treatment to treatment, whether it's a pill, an injection, an infusion, chemotherapy, or a targeted agent. And so that's what interferes with people's, physical functions in terms of what they can do on a daily basis, and may have one of the bigger impacts on their quality of life. But there are definitely things one can do for all of these different types of treatment. You can, some of it's dietary, some of it's exercise related, some of it's sleep related. And, for every individual patient, just like you need to come up with an individual treatment plan, you have to come up with an individual plan to try to, prevent. That's our big goal, is try to prevent side effects. But amongst those that have them, to try to treat them early so that they don't have a big impact on the patient if we can.
Thank you so much for that.
And I also just want to add to what Dr. Hershman said, that on top of what we do, as part of the standard treatments for taking care of patients and trying to manage side effects, at least here at Columbia, we have a very large research interest in improving long-term quality of life and trying to minimize side effects. So we do have many clinical trial options that we can offer our patients in terms of trying to have the best experience possible despite going through these treatments. One of the big side effects that we worry about with certain types of chemotherapy is neuropathy, which could present in many different ways, like numbness or tingling in the hands and the feet. It could be something that lasts for a short amount of time, or it could be something that can last for many, many years after treatment and can really impact quality of life. And Dr. Hershman has really been a pioneer in terms of trying to understand how best to prevent these side effects from happening, and trying to do trials to find interventions when they do occur. And we here at Columbia are running a large device study to try and prevent chemotherapy-induced neuropathy using non-medication, using either cryocompression therapy, which is cold therapy, and compression therapy, or different forms of compression therapy that we're borrowing from the technology from the scalp cooling that she mentioned as a technique to try and prevent hair loss during chemo. So yes, there are many standard ways that we monitor side effects, but there are also novel ways that we are trying to do better too.
Fabulous.
And not to take up too much of this, but
no, go ahead.
It's critically important in cancer that we're constantly trying to move the field forward. Better treatments, sometimes more treatment, sometimes less treatment, sometimes, better side effect prevention, the whole spectrum. And so often when you come to see an oncologist, they're going to talk to you about a clinical trial. And it's a very important component of, being at a major medical center, is that you may be somebody that falls into an area where there's a new treatment that shows a lot of promise, or, a new, as I said before, a new way to prevent a side effect. And that, there are all different kinds of studies. They're, across the board. Some are randomized, some are not, some are placebo, most are not, but, that it's always important to be open-minded to the opportunity to be part of a trial, because it's an opportunity for the patient to be part of the process, maybe get a better treatment sooner, but also to iteratively be part of the process that has gotten us so many better treatments over time.
So even in understanding the treatment options and everything out there, how do you feel about individuals seeking a second opinion? Is that important? And how can, I guess, if patients kind of do their own homework, right, how can they also advocate for their needs during a treatment process between their first physician that they may have gotten diagnosed with versus getting a second opinion?
Did you want to?
Oh, yes. So how are your feelings on getting a second opinion?
I mean, I would say that it's really important to get a second opinion especially if there's any uncertainty. If it's really by the book and everything is as it should be, and you feel comfortable with your team, maybe a second opinion is not so important, because you're going to get the same opinion wherever you go. But if there's any uncertainty, if you're unsure about, these are long-term relationships. And so one is making sure that you're getting the right treatment, and the other is making sure that it's the right match with your care team. And so we always encourage that if it's a patient that's seeking a second opinion, we're even happy to help tell them like who other people in the field might be good to go to. But people shouldn't feel that they're going to hurt the feelings of their doctor or try to keep it a secret, maybe, because we all get it, we all understand and we expect it. And so people should do what they feel most, comfortable with, and work with the providers even, and let them know.
Thank you. Dr. Accordino, do you have anything to add to that?
Yeah, I completely agree with Dr. Hershman. I also think that second opinions can be in many forms. So, Dr. Hershman, I take care of a lot of patients with breast cancer, but there are many other types of cancers that we take care of here at Columbia, and some of them are much more rare and much more complicated. So sometimes even just having another institution review pathology slides, so getting a second opinion in that way could be really helpful in terms of trying to figure out the best course forward, especially as Dr. Hershman mentioned, if something is not 100% clear cut or complicated, sometimes just having more eyeballs on it can really be helpful.
Thank you both. And to kind of round this out in terms of like the family or relation component of it, how can loved ones support that individual or the patient, but also still respect their autonomy and choices? Because I'm sure you must see all the time when family members come in with the patient, they may have perhaps dueling needs or wants in what they think an individual should do. How do you all tend to address this, or do you?
I think every patient is different and every individual is different and every relationship is different. So I think it's really important for people to understand that, and, people process these diagnoses very differently. And as Dr. Hershman mentioned earlier, it's, a story that unfolds over time. So how someone feels about something in the very beginning might be different a few weeks later. And I think having compassion and patience and being able to hold space, I think, is really important. I think people can be supported in many different ways, but that can look different from individual to individual. Sometimes it's coming with them and just being a presence. Sometimes it's being an advocate, taking notes, helping to gather information. The most stressful part that we often see during this journey is right at the beginning, when there are many, many questions and not a lot of answers because we're still gathering as much information. There's often a lot of testing that's done. There's often very complicated schedules. So whether that's helping to organize, help drive, even just helping at checkout, saying like, I got this, I'll help take care of the appointments. Like, you sit down, just take a breather, can be helpful. I think, in terms of thinking about second opinions, a lot of that can be stressful in terms of gathering all the information and the documents that are necessary to give a good second opinion. So having an extra set of hands to gather medical notes, get the releases signed, get all the discs and all the slides together can be really helpful from an organization standpoint. But I think just having support and knowing that someone's there to encourage, be an advocate, be an extra set of hands, it goes really a long way.
Thank you. Dr. Hershman, do you have anything to round us out?
Yeah, I think that, having other people, everybody hears things different ways. And so sometimes when it's you're the person, you may not hear it all the right way. So having a support system is good. I think that, as Dr. Accordino mentioned, it's an evolution. And so, making sure that, you have the right people around you, especially when you have to make a decision, is really probably the most valuable thing. But they don't need to we've gotten much more adept at doing all different, including people in all different kinds of ways. whether they're on a Zoom or you're having a Zoom with the patient and their whole family, or having some people call in or telehealth in, or even with their iPhones, whatever it is, where the patient feels like, they have the support that they need. And not everybody does. Like, we have to recognize everybody comes at these things, differently. But for those that do, we're always happy to work to include people, even that may not be in the same state, that we can figure out a way to include them in the decision making if that's what the patient wants.
Thank you. That's so valuable, because here at Columbia, just to let everyone know, in case you didn't, you have so much support and resources, which we will share at the end of the webinar with the two here also. And thank you so much to our two fabulous physicians uptown, because we also now want to bring in and tie a little bit more of the pieces of the two additional support services we have here for Columbia faculty and staff and their family members. So with that, I actually want to kind of start us off with that emotional and logistical support. And if Dr. Hernandez, if you want to start us off, and I'll ask you this question because here at Columbia, for those on the UHC medical plan, there is the Cancer Support Program for those in the plan. So Dr. Hernandez, can you kind of give us an overview of the role that the Cancer Support Program plays in offering assistance to those diagnosed with cancer or even family members?
I'd be happy to, Camila. And first of all, good afternoon to everyone, and thank you. I'm honored to be part of the panel today, to be able to speak to you. I heard a theme with respect to the cancer care, and that's teamwork. So you do, especially if you have a UHC coverage, you do have another team called the Cancer Support Program. It is a team of nurses that are, on average, about 10 to 12 years of oncology experience. That team is basically there to engage and target the membership that has a diagnosis of cancer. The team is supported by board-certified oncologists that oversee that particular nurses team. And also social services, as well as pharmacists that support that particular specialized clinical program for you. I get to work closely with them. Some of the things that these nurses, when they engage with the member or the patient, they're going to discuss not only things like signs and symptoms and kind of what to expect on the basis of that oncological experience that they've had themselves, as well as providing education. We have a program known as Care Paths that can definitely use the power of technology to be able to push basically via technology education about the pathway of dealing with cancer. Things that are important, like diet, for example, and while undergoing chemotherapy, certain things to kind of stay away from, like runny eggs, right? Or unfully cooked eggs. Something as simple as that sometimes may not be necessarily part of those initial conversations, because the clinicians are busy basically tailoring that specific chemotherapy regimen or pathway. But also looking at other gaps. A lot of times there are patients that have cancer dealing with that, but they're also dealing with things like hypertension or diabetes, and looking at those gaps as well. Things that they also address are the mental aspects. They do screenings for anxiety and depression, and they have a dashboard that they're able to see on the UAC membership. They're able to see other benefits that may be complementary to that particular patient. The other aspect that these nurses do and they ask is things like social determinants of health, financial hardship, social isolation, for example. They also discuss difficult conversations from the clinical side, like discussing a living will and DNR status for that member. The other thing that they do is kind of, especially when they do long-term engagement with the members continuously, is the right of survivorship. So now I'm actually in remission, what to expect. And a lot of the members and the patients, basically, when they do go into basically remission, they actually ask the nurses how can they give back, how they can become involved. The nurses are prepared to give patient support groups that are within their community, some even within your own organization. In general, the patient that is nearby Columbia and is there is very fortunate because Columbia as an organization happens to be one of our centers of excellence, where a lot of these the studies and I call it the forefront of the studies of cancer medicine are ongoing. But I think, again, the group is there to support, be part of that team, navigate difficult conversations, maybe educating about things when the story is not about remission, but a story is about terminal. And how does the member want to spend the last 6 months of their life, whether they are adequate for palliative versus hospice. In palliative, there are differences. Where hospice, you have to kind of subside all extended type of therapy. Palliative, you do not. So understanding also pain control, because it can be a painful diagnosis as well. But we're not only inclusive of supporting the patients, but we, especially if the patients happen to be clinicians, there's an old saying that says, we tend to be the worst patients, right? So as a whole, we try to be inclusive of pulling in your family as well. Definitely being proactive, always keeping in mind release of information processes, obviously making sure that the privacy of that patient is kept in mind. But I would be remiss not to also chime in about a program that lies at the forefront or at the periphery of the Cancer Support Program. With United, there's a program that basically looks at the process of targeting that member engagement early on. Basically, it's monitoring whenever there is a claim or a diagnosis that is requesting either chemo and or the diagnosis. It'll trigger that nurse support. What else does that program in the periphery that's called Cancer Guidance Program? It is kind of facilitating the care paths, or what we call the standardized, usually common cancers have a standard guideline to them. This process is guided nationally by the National Cancer Support Society. And basically, what our process through Cancer Guidance does is that it actually populates and alerts the requesting provider of those NCCN pathways that have the least side effects and that have good outcomes for that particular cancer. If that deviates from that, because we understand certain cancers and the pathways may not be all there, especially on metastatic and more complex types of cancers, then we do actually capture the clinical studies so that we have a NIH-trained nurse and a clinical trials nurse that captures that information with these interactions with the ordering physicians. So I find that, it's a great program, although I have to say that as an entity, for those members that do end up getting that patient coordination and getting that support within the system, but also keeping in mind that standardization of that treatment. Let's say I am an employee and my daughter or my son may be going to school in California, and the footprint, and they choose to get their cancer treatment there. The Cancer Guidance also looks at that standardization across the board. And I don't know about the clinicians here on the panel, but keeping up with these NCCN ever-changing pathways is difficult. Every week I get alerts in my email of new changes with new advances, new treatments, and new trials as well. So that's an important piece. And the innovation within that program is that We now are able to text to enroll. We're able to secure text, secure email, video chat. We can actually, if a nurse is calling out and you happen to be sitting in an infusion chair, well, we can actually provide you a link that you can schedule the appointment to continue with that support nurse at basically meeting you as needed, whether you want to be your family be part of it as well. So the scheduling of those appointments with those nurses is also viable now.
Thank you, Dr. Hernandez. That was an amazing overview. But I have one quick question I'd like to follow up on that. Is there additional, how do I put this? There's no additional like payment for this particular program, is that?
No, there is not. It is here. And it carries a heavy, for those members, when we survey them and they actually engage with the nurse, the net promoter score for that program is in the 90s, meaning that those that do end up and pick up the phone, they find it valuable and recommend it to others for the support that the nurses are actually and the level of experience that are providing as well. And if things like social services, if when to go to disability, when to retire. So some of the pieces, we have the resources around the social services component as well as the pharmacist that you can ask questions specifically around other medications that you may be taking that may interact with the chemo. So
thank you. Wow, I can really see how that team effort that you were alluding to when both Dr. Hershman and Accordino were mentioning earlier, it really is, I can see all the different pronged approaches to this. So thank you very much. And with in noting our time, I want to also bring up what the Employee Assistance Program, what does it do in terms of supporting individuals diagnosed with cancer and their families? So I will give the floor now to Alan. And just to showcase to everyone, so the EAP is for everyone, even if you are outside of the UnitedHealthcare plan. So I just want to make that specific note.
Thanks, Camilla. Hi, everyone. Thanks for bringing that up, Angela. So just to run through the Employee Assistance Program, there is some overlap between what we provide in terms of benefit and what Dr. Hernandez had covered. Let's move to the next slide. So first off, the program itself is voluntary. You don't need to sign up for it in advance. We maintain confidentiality, so we don't share any information with any outside parties. You can call us any time of day, any day of the year, so it's 24/7 access. National in scope, so we can support yourself, family members, if you happen to be in another state outside of the New York, New Jersey area. No out-of-pocket cost, so nothing for you to pay for yourself. And we cover all Columbia employees, their spouses, dependents who live in the home, and also children who are away at college. So the benefit provides short-term counseling support, so up to 6 sessions per case. We also help with referrals for longer-term counseling treatment. We also can help in terms of finding concrete resources. So I think this is where we might have some overlap with the United benefit, finding in-home care, rehab facilities, community support groups, which is also invaluable to patients and their families, transportation services to doctor's appointments, and financial consultations. So free consultations with financial experts, ranging from things related to credit counseling, debt consolidation, cash management. So some critical services to help yourself, the family who might be going through some financial challenges while you go through treatment. And I think we can move quickly through the remaining slides here, just to let you know there are different modalities available to you. So if you prefer to work with a mental health counselor by phone, video, in person, those choices are available to you. We have a chat feature through our website where you can chat with someone if you'd prefer that type of interaction, and other self-help, more self-directed resources if you prefer just to go with your own pace rather than working directly with a counselor. Now let's move forward. And some resources on our website, TELUS Health One, again, the ability to chat with a counselor in real time. We have some great well-being assessments for people just to assess your overall health in different life areas. Let's move on to the next one. And just in order to access our mobile app, you would go to your app store, type in TELUS Health One, and obviously TELUS, we provide a number of different apps. So TELUS Health One specifically is what you want to search for. And let's move to the next slide. And easy to access our program. I recommend calling the toll-free number listed here, accessing our website and our mobile app. Again, you go to one.telushealth.com, username and password listed here. So very easy to access our program either digitally or through the phone, and of course some other modalities that I mentioned. So I think I'll pass it back to you, Camilla, unless you have some other questions about the program.
No, thank you so much. So I'm finding a common theme here with everyone, and this is, I'm going to pose to everyone at this point, because I know that between Uptown and our individual programs that we have with UHC and the EAP, are there particular placements like outside, well, hold on, let me rephrase this better. What other benefits or navigation tools would you give particularly to patients in helping them assess maybe, let's say, other things, including maybe even if it's understanding their medical bills, insurance, or finding those financial support programs? Does anyone here specifically have a response to that?
So we have a piece, I mean, I can definitely chime in, but we do have a piece, Camilla, that helps the cancer resources, especially explanation of benefits and the signs, and also the social worker who is able to look for other resources as well that works with the cancer support program. So that is part of if the question revolves around things like benefits or out-of-pockets or coverage, that's something that the frontline cancer resource advocates are able to do for the member, as well as engaging social services consultations to find other resources.
Thank you. Thank you, Dr. Hernandez.
Yeah, and I can jump in again, Camilla, just to kind of reiterate some of the services I mentioned. We have adult care specialists to help patients and their families locate resources in the community. I touched on before, like a support group would be an example of that, finding transportation services. So this provides the family a resource where they can get some expert advice and guidance on how to pursue these resources in the community. And it takes a lot of the pressure and the stress off the family from having yet another thing on their to-do list that they have to take care of. Someone to kind of guide you through the process, do research for you, and connect you to the resources that you and your family member will need.
Thank you very much. And so I'm going to pose this next question to Dr. Hershman or Dr. Accordino. The question actually is, so what are the benefits of cancer support groups, and do you recommend them to your patients, that type of thing, or are there other resources for both patients and caregivers that can really help individuals cope, through these challenging times?
I mean, that's an excellent question, and it's very individualized. Some people, really get a lot of, reassurance from knowing that they're not the only one, and sort of information that they can get from other people helps them think of things that they've never thought of before. That being said, sometimes it has to be the right time and the right group, because it can be also very anxiety provoking for some people to hear everybody's different circumstances that may be very, very different than their own. And that can sometimes make people worry about things that are not really relevant. And so you sort of have to do an internal check to figure out, is this or even try it, but you don't need to continue it. Is this right for me? Am I getting benefit? Is this increasing my anxiety? Is it relevant to me? And sort of think it through themselves. There are all sorts of other things that people do in addition to support groups. We work a lot with patient advocacy groups. And so sometimes when patients are in treatment for a while and then they're more stable, they get involved in the cancer advocacy community. And that a lot of people get a tremendous amount of satisfaction from. They do meet other people that may be like them, but it's sometimes focused on something specific, whether it's advocacy and for clinical trials or for getting money for sources or for other things, for research. That's another option that sometimes people can pursue. So it has to be the right kind of group for the right kind of cancer at the right stage. All of those things make a difference.
Yeah, I could actually jump in on that a little bit more, Camilla. I think a lot of what Dr. Hershman was sharing is certainly true. What we see is that patients get a lot of therapeutic value from support groups. Just knowing that others are going through the same experience can be very sort of validating and reinforcing for them. And also the sense that they're not alone, that someone else is going through a similar experience can really help their emotional well-being and ultimately their recovery.
I would also say, that echoing what Dr. Hershman said is that it really is very individualized, and sometimes patients can get very engrossed, especially on the social media version of the support groups. Sometimes you have to kind of let people know that on those groups, especially on social media, the emphasis is usually on bad outcomes, not necessarily the most common outcomes. It kind of is like a restaurant review on Yelp. The people that are posting are really the ones who had something catastrophic go wrong with their meals. That's not necessarily embodying what it's like to eat at that restaurant every day. So I think we have to kind of give fair warning that the resources that are out there, it's really an individualized approach, and what works for one person might not work for you, and what might have worked for you before, maybe it's not the right fit anymore. So I think there are a lot of resources, and we have to kind of come at it individually for that right person at the right time approach, like Dr. Hershman mentioned.
And I do see 2 questions here in the chat. So I do want to at least give these 2 individuals time for that. So I'm going to go with the very first one. And I guess this one's more for Dr. Hershman or Dr. Accordino, which is if you have a family history of any breast, ovarian, uterine, or colorectal cancer, will you be at higher risk for developing these types of cancers? And how can you be screened for those cancers?
I mean, that's an excellent question. It's really important to know your family history. Screening, there are general guidelines for people in terms of, especially for breast and colorectal cancer, where, there's mammogram screening and colonoscopy. But those screening recommendations are different depending on somebody's family history, and also whether or not there's a gene that runs in their family that may put multiple family members at risk or may make them at risk for multiple different types of cancers. So it's really important to share that information with your provider. Sometimes the screening recommendations are different. Sometimes they involve different types of tests. Sometimes the provider might get a genetic test or send you to a genetic counselor to make sure. So it's important to know that not only that your family member has a history of cancer, but whether or not they had any genetic mutations associated with, germline or blood related issues that may put you at risk as well. So again, some of the family history depends on the age in which your family member was affected and all sorts of very specific things. But those are very important pieces of information to share with your provider so that they can make sure you're screened at the right age and in the right way.
Thank you so much. Yes, that one. Can't stress enough on the preventative piece and understanding and knowing our own bodies. And there is one question here for Dr. Hernandez. Where can an individual find out more about the nurse support group or the cancer support program, I should say?
Yes. So I have definitely, if you want to do it with an outreach via telephonic, the customer service phone number behind the actual membership card will have it, a UHC membership. And then I also can put, I was actually going to give you an overview that comes in from our UHC online information. And it actually has multiple numbers and or a process where a referral can be done. So I'll pass that on momentarily. Hopefully that'll be helpful to do that. And if there's any unique specific concerns, definitely be able to help. I'm here to support the membership.
Thank you all so much. So we have a few minutes left here. If we have any last lingering questions from our audience members, feel free to put them in the chat currently, because if not, I can always leave us off with one final question for our panelists. Give it a minute here. I might even queue up what my final question is to all of you. Okay, the individual questions. Okay, there is one final question here. Let me just read this quickly. Okay, I can ask this one. Dr. Hernandez, is the UHC support or cancer support program available to those who don't have cancer, but a biopsy showed that lesions and currently going through preventative care? Is that something available to, so if a person does not have cancer, can they still access cancer support services?
So usually it's targeted, since it's specialized, Camilla, it's targeted to those who have the diagnosis, but we have other clinical programs, especially those who have cancer or other chronic illnesses, whether it's someone with diabetes and hypertension and or other conditions that may be also proponents of actually some risk factors to developing in the future a cancer as well. That, yes, you're able to actually get a hold of what we call general complex disease management nurses. But the customer service, again, you can call, you have advocates. Those advocates can actually look, and a lot of the times when you call the customer service and the back of that card, they're going to actually suggest to you, you need a colonoscopy, or you may, we see here that you haven't had a mammogram done. So definitely something we can support from a clinical support program, not necessarily specific to cancer, because the ones that are specialized target for those who do undergoing the cancer journey.
Thank you so much. That's also important for everyone to know, that use your insurance for whatever journey you may be on. And with that, I just want us to, I'm going to propose this to all of you as we wrap up here today. Is there a final takeaway you'd like for our audience to remember from today's discussion? If whoever wants.
I would just say that I know being in this situation or dealing with a family member or even being high risk for these types of cancers can be incredibly stressful, but just know that you're not having to deal with this alone. There are lots of resources available, and however we can help, we want to be here to help you.
I echo your words, Dr. Accordino. I do too. It is a teamwork approach, and you're not alone.
Yeah, similar message from me. Most people, the EAP is not top of mind for them, but just knowing that we're there and we're there to support you and your family is probably the biggest takeaway for today.
Yeah, I would say it takes a village. Like that's the theme that sort of has come up of people with all different types of backgrounds, but not just your doctors, which is a big team, but the nurses and the social workers and all of the support services to sort of help address, your complete picture. And so it's important to, make sure that you communicate so that, your provider can help link you to whatever that service is that you may need.
Thank you so much. Truly, thank you to all of our panelists and our audience today for your participation. That was really well done. We didn't plan that, everyone. That was just them. They're fabulous. So thank you again to everyone. We will be sharing again with the follow-up to the video recording and even the resources offered uptown at CUIMC through the EAP and even the UHC Cancer Support Program. And so with that, if you have any particular questions, feel free to reach out. So thank you, everyone, and enjoy the rest of your day. Thank you.
Thank you.
Yeah.